My name is Dr. Shaun Matthews, and I'm here in the beautiful island of Barbados for the Caribbean Dental Program 2018. For me, it's an absolute pleasure to be here. Although I am currently at the University of North Carolina in the United States, where I practice as a clinical associate professor in oral and maxillofacial surgery, I am also very much a Barbadian and fiercely proud of it. I left these shores 30 odd years ago to pursue a dream, to become a surgeon, and that journey has taken me from dental school in Scotland to medical school in London, and thereafter with my postgraduate training to become a consultant surgeon in London for 11 odd years. I was very lucky enough then thereafter to be recruited to the University of North Carolina School of Dentistry, and I'm currently there on faculty as of just over 3 years ago. To be part of such an important continuing educational program that Dr. Eastman and his phenomenal team have accrued is truly amazing. While I've been here, I've been lucky enough to give 2 lectures. My field in medicine surgery very much revolves around oral and maxillofacial surgery, so facial reconstructive surgery, and reconstruction of damaged jaw joints in particular, so joint replacement surgery is what I'm best known for. The first lecture I gave very much focused around the management of jaw joint problems and considering whether or not surgery was an option, whether or not it should all be non-surgical treatment. And during the course of that lecture, what I attempted to do was speak a bit about non-surgical management, speak a bit about minimally invasive procedures that are used to treat jaw joint complaints, and speak a little bit about the more contemporary, state-of-the-art joint replacement surgery, which is end-stage joint disease and which is very much high-end surgery and revolves around using important informational technology modalities like virtual surgical planning, computer technology. My second presentation revolved around the use of what's called virtual surgical planning in the treatment of patients with complex jaw joint complaints. And basically what that described is virtual surgical planning being a state-of-the-art computer-generated software which is currently available to us as surgeons, where we can plan all the surgery on computers to make sure we get precise reconstructive options and make sure we get accurate results to improve patient outcomes and to improve patients' lives. It's been great being here, it's been great being a part of this program, and at least for me, if those who are in the audience who do not necessarily understand the language that we use on a day-to-day basis, being clinicians and surgeons, if at least it took away a tiny portion of knowledge from my presentation, then for me that's job done. I'm entirely happy. It's been a real privilege to be here, and I thank Dr. Eastman again and his team for having me. Thank you all for listening, I appreciate it. Thank you for coming.